Let me welcome the three speakers. The three speakers are well-known scholars. So let me give the floor to the first speaker, Antonio Spilimbergo from IMF. Antonio, the floor is yours.
Pato, thank you very much, and thank you for the opportunity to present in this excellent panel. This is my own opinions, and they don't represent the board of directors, the IMF. I'm going to present 6 stylized facts about the Great Lockdown and the lessons they can teach us about the recovery. First fact, at the beginning of the lockdown, there was a big debate about how the possible eventual recovery would shape. There was an alphabet soup, a K, a L, an M, a U, and at the end, now we can say safely that for countries which are vaccinated, it's clearly a V shape. It's as soon as a country reaches a certain level of vaccine, there is a strong V-shaped recovery. And this was not taken for granted at the beginning. For instance, a paper before was mentioning that until everybody is vaccinated, in other countries, you don't have a full recovery. We know that is not the case, and countries are really recovering very, very fast. And this is amazing also when contrasted with other experiences. Look, for instance, at the right-hand chart where I just plugged the GDP level in advanced country and during the Great Lockdown and during the financial crisis and with other recessions. And you can see that really the Great Lockdown had a biggest drop, but at the same, a very strong bounce back. So this is the first stylized fact, which is very important, and we are learning a V-shaped recovery. Second, why? There are 4 factors, I think. One is unprecedented policy response. This was really unprecedented in terms of magnitude, both fiscal and financial. Second, there was no financial crisis. In March 2020, emerging markets, all markets went a little bit crazy, but that was a really confined issue. And so this is what explains why this crisis is going to be V-shaped. Third, we did anticipate this scientific breakthrough. All leading scientists would say at least 1 year, if not more, to have a vaccine. We had a vaccine, a very efficient vaccine after 9 months that the crisis was declared. And finally, what is more important, and the previous presentation hinted at this, learning. We had a lot of learning. Government learn how to do better measures, containment measures. People learn how to live together with these containment measures much better. And economic activity also learn how to live with this crisis. Going at about learning, for the sake of time, I will focus on the sensitivity of mobility to cases and lockdowns at the middle chart. And as you can see, at the beginning, there was a lot of sensitivity in the sense that once you have a doubling of daily cases, you have a big impact on mobility. Or if there was a introduction for lockdown, you had a big increase of a big decrease in the mobility. Over time, you had people learn, the mobility became much less sensitive to this either mandated measure or number of deaths, the fear factor. So somewhat people learn how to live together. Maybe it's good, maybe it's bad in some cases. I will talk a little bit later about this. And also this is quite impressive. This is the PMI index in April 2020, so relative at the beginning of the pandemic, and this December 2020. And here is cases per million in various population. As you can see, in April, there was a huge drop of activity, while in December, there was much less sensitive of a decrease in PMI, despite an increase in number of deaths. So one lesson that I think is important we drew is that ex ante, we believe that the bounding constraint was scientific progress and production, scientific progress. Ex post, the speed of the recovery will be determined by the production of the vaccine, the logistic, trust, and political constraints. This is something that I think it's important to keep in mind. I mentioned exceptional support. These two pictures show that one is the income support, which was really amazing, especially for advanced economies. Here is the share of countries, advanced economy in blue, that gave big support to households higher than 50% replacement income support. And it was a strong response, even is less, and as we know, in leaks is much less. The result of this huge support is this, which is, I find, an amazing picture. If you have to remember something about the presentation, is this. If you look at the number of bankruptcies by quarter, since the beginning of the recession, the normal behavior is the green or the red line. During the global financial crisis, the number of bankruptcies went up quite a bit. During the other recessions, also you have the number of bankruptcies went up. In this recession, number of bankruptcies went down. So why thanks to the incredible measures that we're taking. So this speaks to how policy measures made a big difference during this crisis. As I said at the beginning, you have some learning, policy measure, and avoidance of financial crisis. Going forward, another thing that is quite amazing, and there's also quite a result of that, is the behavior of household savings. Household savings during the recession have an ambiguous behavior. During this recession, you have a huge increase in household savings in all OECD countries. This contrasts starkly with what happened in previous recession. Here I just put the picture for United States. Household saving went from about below 10% to more than 35% in the middle of the recession. As you can see, here I show all the behavior of saving rates during previous recessions, and you don't see anything like of the magnitude we have now. So this is, again, is something that this recession was very peculiar. This begs the question whether you have, this is a smoothing or precautionary or forced saving people couldn't spend. I haven't seen convincing papers so far try to disentangle this, probably because we don't have enough observation. I think we have to be more careful. This is very important to understand also the nature of the recovery. And this is very important also for the debate on fiscal stimulus in the US. This big frozen amount of savings which could hit the economy as soon as people can spend. So if you look at the balance sheets, basically households, most of household balance sheets are stronger, much stronger than in previous recession, especially for people who had a stable employment. We know that other poor people suffer quite a bit, but overall household balance sheets are strong. Non-financial corporates balance sheets are much better than other recession, but here we have no way of knowing what is going on, given that we had a lot of measures that were taken in the middle of the recession. Banks' balance sheet, which reflect with the delay in non-financial corporates balance sheet, are good with respect to and this is the reason why we didn't have a financial crisis. This is very much crucial for how we exited the recession and how central bank will react, because this is it's quite different from other recessions. Apart from saving, what is interesting is the behavior of consumers, which also I'm drawing the parallel between this recession and other recession. Here is for advanced economies during the great lockdown, the consumption of durable goods, which jumped, of non-durable goods, which jump as well and after went a little bit down, and services, which collapsed. This is very different from the other recession. And this is what here I plot an impulse response of past recession in the US. Here the share of durable, non-durable, and service as before, both the US and starting in the last 20 years, I think. And as you can see, during the typical recession, there is a contraction of durable goods. In this recession, there was a huge increase. There is a contraction of non-durable goods and some relative increase in services, which is the mirror image of what happens in this recession. So the recovery will be a little bit, because when we think about the recovery, a way of rebuilding buffers, ideal buffers, now the buffers are very different from what are in the usual recession. Finally, is it a demand or supply shock? I think that at the beginning of the crisis, we emphasized the supply shock. We imagine a Leontief production function. There was a lot of talk that also my colleague and friend Gnan was highlighting, of rigid global value chain, where basically if you, because of COVID, you disrupt the production in one specific country, this would have a chain effect to the production to all. This model, they are elegant, but reality turned out to be very different. The supply shocks were much less than expected. Actually, trade now is bigger. The volume trade is more than it was just before the recession, even in terms of trend. And the demand shocks became more relevant. Some examples: car producer and chips. The reason why there are a short of chips is that there is a huge increase in demand, more than there is a drop in supply. So what we learn from this experience is that global value changes are more resilient than what we thought. Here is what I show is about world trade. That is, this recession is very different from the other because you had a big drop in trade volume, but also a huge bounce back. So trade actually is going back much faster than before. Before the global financial crisis, the common wisdom was that financial integration would improve resiliency. And the issue is that the Greenspan's doctrine, you could basically insure yourself. There are notable exemptions, like the paper by Raghu at Jackson Hole. This view was wrong, as we know. Actually, financial integration brought decreased resiliency. I think that with the lockdown, we have gone through a similar process. Before the lockdown, we emphasized a lot and were concerned that global value change would amplify local shocks. And so COVID was really bad. The opposite happened. Global value change proved remarkably stable. Conclusion, we overestimated financial resilience before the global financial crisis and underestimated trade resilience during the COVID crisis. Summary, we have a V-shaped recovery because there was no financial crisis. Learning is important. Exceptional policy support, exceptional saving behavior, exceptional consumption behavior, which will make the recovery and the policy during the recovery more interesting, and some interesting resilience that we have to study more. Thank you.
Thank you, Antonio, very much. Very interesting. Now the floor to Luiz de Mello from OECD. Luiz, the floor is yours.
Thank you very much, Donato. It's a pleasure to share this panel with Antonio, David, and Cecile, and thanks to you, Donato, and Ernest for the invitation. I'll spend the next few minutes to talk about essentially some recent work here at the economics department, trying to answer one basic policy question, which is how to reduce the spread of the virus while minimizing the economic costs. And we looked at essentially a variety of containment measures, but also public health measures that I'll get to in a minute. The containment measures are essentially the ones that we heard about in the previous panel. I'm glad that Anna already took us through the several of the measures that are included in the Oxford indicator data set, which is the one that we used. So indeed a great public service in this area. But containment measures that we are looking at are essentially the stay-at-home requirements, school and workplace closures, restrictions on gatherings and public events, closure of public transport, travel bans, etc. But also looking at the public health measures, essentially tracing, tracking, and isolating, mask wearing, testing and visit restrictions in care homes, etc. The numbers that I'm going to show you are essentially numbers for the first wave of the pandemic, so the first half of last year. So there's a typo there, it's 2020 first half, essentially based on this paper there by my colleagues. So we haven't as yet looked at the latter part of last year and the beginning of this year. So we're currently working on that. And that's an interesting exercise because it allows us to look at the important role of vaccination in this, as was discussed in the previous panel. What we do essentially here is to look at the effects of those containment and public health policies on the reproduction rate and on mobility as a proxy for economic activity. Mobility here is basically the Google tracker. So basically, you know, as was mentioned before, the cell phone geolocalization based indicator, the reproduction rate that has been mentioned several times. We are now looking more directly at measures of economic activity rather than focusing on mobility as a proxy for that. But essentially, as I mentioned, a combination of OECD and the Oxford indicators. These regressions are basically used daily data, starting then at the beginning of the pandemic. And those are regressions in logarithmic form, and regressions that, in addition to those policy variables, also include country fixed effects to capture, as obviously you know, all the other country-specific factors that we cannot control for, but also the death rates globally and nationally as a way of capturing, let's say, behavioral responses, caution arising from the simple awareness of the seriousness of the situation. And we see that that variable plays an important role. So what do we start off with? Just a chart to show for the world and for the European countries, the reproduction rate. And we can see, if you go back as far as February last year, the beginning of the pandemic, so that the R came down from around 3 at the beginning in February to something from April that was around about already hovering around 1 for the global sample. For the European countries, we had a similar pattern, but an increase in R after the summer in the northern hemisphere. So from July, August, September, the peak in October to close to 1.5, and then came down again to 1. And we are seeing a different pattern this year as well, which again we'll capture in the sequel to this paper. But if we focus on the lessons from the first the first phase of the pandemic, what we see, if we take into account of all those containment measures and the public health measures that I mentioned briefly, and if we use the coefficients of these regressions to then infer the impact on R, we get a picture that looks like this. So it's basically, if you look at containment policies, measures like banning public gatherings has an important effect in reducing R, and then the variety of lockdown, shutdown of economic activities and workplaces and school closures, another block of important interventions that can help to reduce R considerably. I mentioned those three together because they're usually part of a package of a typical lockdown, and those indicators tend to be collinear in those regressions. So you can think of them as part of a package of interventions that tend to be rolled out together. And also issues or measures related to restrictions to domestic travel and international travel as well. But so if you think of those stylized policies taken together, those are enough to basically, bring R down by almost half when implemented in full. The public health policies are also important, and what you get from the number crunching is a strong impact or effect related to testing, tracing, and isolating. That we looked basically at the most comprehensive versions of those policies that are coded in the Oxford indicator, but also attention to the care homes, so testing care homes, restricting visits, and in addition to that, some stay-at-home recommendations for the elderly as another block of policies targeting a vulnerable segment of the population. And those policies also have an estimated rather strong effect on R. And another block of policies related to isolating international travelers as a means of reducing the spread of the virus. Mandatory mask wearing, also an effect, but a somewhat smaller one than the previous interventions, pretty much in line with what we heard from in the previous panel about the relative effects of those different interventions. But what we did then, once we've estimated these effects, was to think of scenarios that could really focus on how to contain the virus while minimizing economic costs. So what this chart shows is essentially the relationship between the reproduction number and mobility. So relative to normal time, so what was the loss in mobility relative to normal? And if you start reading that from right to left, we can start there with the red line, which starts with a pre-lockdown initial R of about 3, which is what we observed, if you remember from the first chart. And awareness alone is enough to bring it down to about 2. So that's the direction of the red arrow. So it's pre-lockdown, but natural caution. So just by people, being aware of the gravity of the situation, that's enough to trigger caution. So it brings R down without much of an impact on mobility. And then we looked at other options that were related to the full lockdown. So FLD is essentially full lockdown. Then you start seeing the point when countries started to implement very restrictive measures. And that's enough, the blue line there, the blue arrow rather, pointing to a significant reduction in R, so coming from 2 to close to 1. But also at a significant cost in mobility. We went from 100% of normal times to something close to 60%. So we both managed there to control the spread of the virus, but at some cost to mobility. And then we looked at the situation where what happens after that if you wanted to relax the full lockdown, but to combine policy interventions that could maintain R under control and at the same time restore some mobility that you would have lost had you maintained the full lockdown as in the previous case. And what we see there is a combination of situations: no lockdown but full health measures, and no lockdown with limited health measures. Then obviously you see that You don't have lockdown, so you don't have a huge burden on mobility, but you don't manage to maintain R at the level you had before. And you had another situation where you have partial lockdowns and limited or full health measures that give you a situation where you are keeping R under control and you are restoring mobility to some extent, but not as in the case where you had no lockdown at all, but you would lose control over R again. So that type of stylized simulation is one that we thought would be useful to illustrate some of the policy choices there. So what's the bottom line here? Well, if your infection rate is high, then it's difficult to avoid the more restrictive containment policies, but you have to accept that that comes with a cost to mobility. If your infection rate is low, then a better alternative is obviously testing and tracing. And if you complement testing and tracing with effective isolation, also special attention to care homes, you tend to increase the efficiency of your measures. So other public health policies that are effective, according to the numbers that I shared with you, are obviously mask wearing in indoor environments, restricting visits to care homes, stay at home recommendations for the elderly, but you still may need to resort to some selective containment measures, depending on the situation where you are, depending on those key parameters that you have. And to conclude, let me mention just these new elements that we need to bring into the picture and we're working on right now, which is the emergence of more infectious variants of the disease. And then you can see, like for the OECD countries, the median R on the left where it was, and on the right, the prevalence of the new variants. And here we have paying attention specifically to the UK variant. And then you can see that as the UK variant became more prevalent, you also see an uptick on the left in R in some of these in the OECD countries taken together. So the importance of looking at the emergence of variants, and we see in some of our preliminary numbers that it does play a role in increasing R. And the other one is obviously the key role of vaccination, and the numbers that we can see that are available, and I'm sure that all of us have been monitoring carefully, shows this huge variation across countries, and even without going to the developing countries per se, you already see that within the OECD membership. So important element also to look at. So vaccinations, emergence of new viruses, and other factors that also are known to play a role here. But those are the key messages that and findings that I wanted to share with you all, and thank you.
Very interesting empirical analysis, food for thought for us. Now, pleasure to give the floor to David Miles from Imperial College. David, the floor is yours.
Thank you very much. Following on from Luiz's excellent presentation, I also want to talk about trade-offs and policy when you take trade-offs into account. And as an illustration of that, I want to talk about the policy choices that are faced right now in the UK, which in some ways is ahead of much of the rest of Europe in terms of vaccinations. But I think the policy choices that the UK faces now will probably be the same choices that other countries, hopefully in Europe, will face very shortly. I want to start out making some very simple points, which in many ways should not be in any way controversial, though I think actually politically are quite controversial, and many politicians, I think, are in some sense in denial about them. The first is that there are trade-offs to be faced with policy, and I'm thinking particularly about policy in terms of non-pharmaceutical interventions, restrictions, whether you close schools or not, whether you close workplaces, do you allow people to travel? That's the kind of policy tools that I'm looking at. And I think we probably would all agree that there are inevitably going to be trade-offs there. The tighter those restrictions are, the tighter a lockdown is, the more likely it is that the infection rates will fall and deaths directly as a result of COVID will be lower. But of course, the side effects are likely to be very substantial. And it is not, and I think we all understand this, this is not a case of lives versus money, lives versus GDP, which is the way that it is sometimes portrayed. But I think we probably all understand that that is not true, is that part of the cost that we will all pay for heavy restrictions, much of which I think is in the future, part of that cost is to do with mental health, people who become unemployed, people who suffer from loneliness. There are mental health costs. There are also, let me give one illustration from some UK evidence, a huge health cost from potential higher unemployment. It's been estimated that just in the UK, and I suspect similar numbers might be true in other countries, the rise in unemployment that occurred in 2009 and 2010 after the global financial crisis caused in the UK 900,000 people to have long-term chronic health conditions, more than would have happened if there had been no increase in unemployment. So when people say, oh, you can't trade off these economic things versus lives, I think they're just not facing up to the reality of the trade-offs that are likely to exist. I think part of the reason why it's very difficult for politicians to openly admit that there are trade-offs between easing restrictions, there being more infections and more deaths from the virus, trading that off against economic harm, but also mental health problems and education costs, which again will generate costs far into the future. The reason why I think they are reluctant perhaps to discuss openly, or indeed sometimes even in policy circles, is that one has to grapple with the issue of trading off lives now versus damaged lives in the future. And that philosophically is a difficult thing. But I want to face up to that issue in thinking about some of the policy issues that the UK government now faces. Part of the problem, of course, making policy, as we all understand, is that there is enormous uncertainty. And some of the sources that are of uncertainty that exist right now have been mentioned already. How good are the vaccines we have at the moment against possible mutations? How costly is it for people to become infected, recover, not die, but have long-term health problems? How serious is long COVID? We don't know yet much about the long-term damage to disruption to education, although there have been estimates made that it is frankly astronomical. Let me give you one estimate. Again, I illustrate it with the UK, but I think it would be true in many countries. The Institute for Fiscal Studies in the UK estimated that the damage that has already been done to the life chances of young people in the UK because of disruption to education is, if you put a money value on it by just working out how much less their future earnings might be, which is a narrow definition of the cost, is something of the order of 17 to 18% of UK GDP. So I think just focusing, as epidemiologists, I think quite rightly, tend to answer in some sense a relatively narrow but hugely important question, which is, if we do this strategy or that strategy, what will it do to the spread of infections? How many people are likely to die if we have tighter or less tight restrictions? And I think that is an essential part of the information that any decision maker needs, but it is only one part of it. And unless one takes into account the costs of restrictions, many of which, as I say, will be felt far in the future, I don't think one can hope to reach a anything close to an optimal policy in the face of this terrible pandemic. Let me talk very briefly about the situation in the UK and then illustrate some of the trade-offs and how one might go about assessing optimal policies. So right now in the UK, many of you may be familiar with the situation here. We've been kind of either lucky or sensible. There hasn't been much sensible in UK policy making about the response to the pandemic, but the rollout of the vaccines has been a relative success. So right now, the infection rates in the UK have fallen a great deal. Partly that's to do with a very restrictive lockdown introduced at the end of 2020, which is beginning to be gradually eased right now. Around half the population has been vaccinated. A majority of adults have been vaccinated. The economic damage done by a combination of people's natural reactions and caution over the last year in the face of the pandemic, and also restrictions on top of that, the economic damage has been very great. The level of GDP is almost 10% lower than you might have otherwise expected. What we don't know is what the scale of costs might be if one were to leave restrictions in place for many, many more months to come, even though the infection rate has been dropping very sharply and new measured deaths from COVID are extremely low now in the UK. I think one of the reasons why it's very difficult to measure the true costs of various restrictions is that they have been masked at the moment by very welcome government policies of cushioning people against the true cost of some restrictions. Unemployment has hardly gone up because of furlough schemes which have supported people, and firms have not needed to make people unemployed. There's also been reductions in taxes for companies. We'll only really know, I think, how much unemployment will ultimately go up, how many firms may become bankrupt once those support measures, as they have to, are scaled back. Let me talk very briefly then about the policy issue that I think the government faces in the UK, and a way of thinking about trading off benefits and costs of being very cautious and not removing restrictions quickly versus the potential benefits of easing restrictions quite fast. I'm going to take a very narrow definition of cost, simply GDP, which I think is a very low estimate of the likely cost of different scale of non-pharmaceutical restrictions. And looking back at the periods when we've had high restrictions in the UK, relatively easier restrictions, medium and low. Incidentally, there's a paper which describes these calculations in much more detail that SUERF has put out as a policy note. You could also see a version of it on my own website. So I'm just going to give you the bare bones analysis here. We tried to identify what happened in the UK, what the impact has been on GDP from different kinds of scales of restrictions that we've seen in place over the last year or so in the UK. In terms of the level of GDP, these have been very substantial when very high restrictions were in place. Basically, the government message was, do not leave home, schools, universities shut, nearly all shops shut. We then use that information and feed it into a model which looks at the potential evolution of the infections and the number of deaths in the UK at different levels of restrictions using an SIR model. And we've tried to work out what the R value is given the time of the year, because there's a kind of seasonality, I think, to R values and the level of social restrictions. And then finally taken into account the scale of vaccination in the UK and how it is bringing down the effective R number, because the number of people susceptible is reduced as a result of vaccination. Putting all this information together, I then look at different strategies that the UK government could follow from this point forward. Some which involve getting rid of the most severe restrictions immediately, some which would involve keeping them in place for another couple of months and then only gradually easing restrictions, and some would be a very risk-averse strategy of more or less keeping the level of restrictions that have been in place in the same place for the next 6 months. What we then do is calculate the cost in terms of easing restrictions quickly, because infection rates would move up, the number of people that die would likely be higher, there would be many years of life lost. And we calculate an estimate of what you might call the GDP cost for each life year saved if you have tighter restrictions rather than easier restrictions. Those are the numbers in the final column. So a number like, for example, the middle number in the final column, £437,000, says that relative to a strategy of very rapid easing of restrictions, if you kept restrictions in place and only gradually eased them over a period of several months, you would save lives, almost certainly, but it would come at a narrowly defined GDP cost of something like £400,000 per life year saved. That doesn't answer the question what you should do, but let me finally say that in some sense there is a natural rule for the UK government to think about using these kind of crude estimates to decide what they should do. In the UK, there is a rule used in the National Health Service which says this: if there is a new treatment available which might increase someone's life by 1 year of reasonable extra life, the maximum in the NHS, the National Health Service in the UK, that you should spend in terms of resources to achieve that kind of increase in 1 extra year of decent life would be £30,000. These calculations suggest that if you have very slow easing of restrictions in the UK, the GDP, the resource cost of that, rather than being £30,000, is likely to be very substantially larger. I will just make some very final simple points. Firstly, easing restrictions faster rather than slower absolutely clearly generates risks, and it generates costs. Costs in terms of there being more infections and there being more deaths from the infections. There are inevitably risks with any strategy. Maximum precaution almost certainly cannot be the right answer, because it ignores the costs, many of which are health costs themselves, of keeping restrictions in place for very long periods of time. The UK government has sounded in recent weeks as if they believe that it would be a total disaster to ease restrictions and then have to reimpose restrictions. But that in many ways is a strategy I believe is a misguided one. Who knows what lies in the future? There could be mutations that hit Europe in 3, 4, 5, 6 months, which mean that the rational thing to do then would be to reimpose the very tightest restrictions we've seen at any point in the last few years. But to keep restrictions at that tight level now, simply to avoid ever having to tighten them in the future, ignores the costs that in itself generates. So I think these tough decisions are ones which in many ways governments have been a little reluctant to face up to. And instead, in the UK anyway, the government has slightly hidden behind the mantra, the slogan, we will be following the science. The science will tell us what to do. And my point in simplicity terms is the science does not tell you what to do. You have to make philosophical trade-offs between harm and cost to different people, often of different generations, which occur at very different times. I'll stop at that point.
Thank you, David. Thank you very much. And finally, it's really a pleasure to give the floor to Cécile Philippe.
Thank you very much for inviting me to join this meeting. I'm really happy to share a few thoughts about zero COVID. I got interested in the zero COVID strategy when I discovered that about a third of the population was living without virus on their territory. And so I was very surprised, and we wanted to know more and to understand what was going on. And so that's how we discovered that actually facing this pandemic, there are two main strategies for dealing with it. The first one being mitigation, which aims at limiting the spread of the virus, with the main goal sometimes expressed as being to avoid saturating the healthcare system. And control measures, as David was explaining, are strengthened as the virus becomes more prevalent and then reduced as it is less common. Elimination strategy has a different goal. The goal is really to eradicate the virus completely to allow for a return to pre-pandemic life, and mainly because it is not believed that we can live with the virus because of its dynamics, because of the variants, because of so many things that we do not know. Actually, we should not try to live with the virus. And once the virus is eliminated, it is then possible to reopen society completely as a whole, while maintaining strict mobility control at entry points, along with active surveillance, which sometimes can lead to local lockdowns, but very short lockdowns, as we saw in New Zealand or Australia or some other place where actually they have to lock down Auckland or some other city for like three days or 5 days. So this is the approach chosen by much of Asia, Oceania, and Atlantic Canada today. And France and most of the all Western countries are pursuing a mitigation strategy. And while we are speaking, many countries are fighting against new waves. On this slide, you can see that despite widespread efforts, the disease has been especially deadly in Europe, North and South America. The impact has not been as great in Asia, Africa, and Oceania. And the data show the value of the elimination strategy and actually contradict the idea, widespread in many Western countries, that it was absolutely necessary to choose between protecting the economy and protecting public health, the notion being that these two goals were in conflict. Here is this second slide, where actually you can see that we did an analysis of the relative performance level G10 countries, and they show that 3 countries, so you can see the United States, Switzerland, and Sweden, accounting for 43% of the population of the G10 countries, have protected their economies more than their people. 4 other countries, accounting for 25% of the G10 population, protecting neither their people nor their economies. These 4 are Belgium, France, Italy, and the United Kingdom, with the worst performances among the G10 in both human and economic terms. 3 other countries, accounting for 28% of the G10 population, did so far a better job of protecting the people and their economies: Germany, the Netherlands, and Japan. And when we broaden the analysis to include the OECD countries applying the zero-COVID strategy, we show that the rift between defending the economy and protecting the population is mostly not relevant. Australia, South Korea, and New Zealand all had lower mortality and smaller declines in GDP. They have all done much better than the G10 average. The reason why we focused on only those 3 countries is because they are the most similar to us. We share the same value. They are democratic countries. We did not look at all the other countries that are doing the COVID zero strategy. So here you can see that we did some work on a change in quarterly GDP compared to the same period of the year earlier. And what you can see is that there are short-term positive effects. Countries pursuing a zero-COVID strategy experience a least severe economic decline in the second quarter of 2020 than the countries that allowed the virus to spread to such an extent that the health systems were saturated. It's minus 4.5 versus minus 11.7%. And actually, the zero-COVID strategy is showing lasting positive effects. And actually, we are redoing the numbers in order to include the numbers that will be soon available as far as GDP is concerned for the first trimester of 2021. But what you can see from the data so far is that in the fourth quarter of 2020, the countries applying this strategy have almost returned to normal economic activity. The GDP was down only slightly, minus 1.2 compared to 2019. And meanwhile, the decline in GDP was greater, minus 3.3% in countries that had not eradicated the virus. Then we looked at the mobility data made by Google. They show that workplace traffic in the second quarter of 2020 fell by less in the countries applying the zero COVID strategy, minus 14% compared to minus 36%. And these data also show that the zero COVID countries retained a significant advantage with a 15% reduction in mobility in January, February 2021 compared to 28% in countries not applying a zero COVID strategy. Actually, Google data also show that traffic in cafe, restaurant, hotels, non-food business and leisure, etc., was down by 14% in January and February 2021 in the countries with zero COVID strategy. And this is much smaller decline than in the countries applying a mitigation strategy. We did also some research on the word restaurants, because actually it has been a big issue in France, where actually restaurants and cafes, etc., have been completely closed for many months. And we were able to see that in February 2021, Google searches for the word restaurant were 64% lower than in February 2019. And this decline was 5 times greater than in the zero COVID countries, where restaurants are open and searches are down only 13% from February 2019. To conclude, we need to have in mind as economists that a crucial factor in analyzing the effectiveness of the strategy that have been implemented in order to control the virus, it's to control the uncertainty linked to the dynamic of the virus. And because after all, participation in economic and social life is a function of people's confidence in being able to take part without running the risk of falling ill, contaminating as others, or seeing health services overwhelmed. The IMF estimates that in developed countries in general, individual choices to practice social distancing account for more than half of the decrease in mobility, with a greater impact than government-imposed mobility restriction. So the lifting of restriction when the virus is continuing to spread does not allow for a full recovery. And this explains, at least in part, the reason why the zero COVID strategy is such a strategy that performs well. And by eliminating the spread of the virus, the return to normal life can be much more complete. So while the benefit of the zero COVID strategy for health is really direct, because as you've seen, I mean, the death rate in the zero COVID strategy is immensely low, the economic benefits arises as an initial investment and return due to the dynamics of growth and suppression. Stopping the outbreak over a short time at a high economic cost leads to a shift to a near normal condition with only localized episodic outbreaks, similar to firefighting, actually. The resulting resumption of economic activity accumulates its benefits over time. So our main recommendation, seeing at these numbers, is really to try to look at this strategy more carefully and to open a dialogue about the adoption of a zero COVID strategy, and to include experts from countries that have been able to implement it thus far. Thank you very much.
Warmly thanks, Cécile, for this, your final recommendation, food for thought. Let me give the floor to Ernest for some concluding remarks.
Thank you very much, Donato. I think it is quite a challenge to summarize what we have learned today in this rich set of considerations that we heard. But let me nevertheless try to give you my reading of what we learned. Since the start of the pandemic, huge amounts of data on measures and on their effectiveness in countries all over the world have become available. It seems clear by now which containment measures work, but it depends on the type of country and society that you do the measures in. Also, measures are becoming less effective over time. Countries differ markedly regarding the sensitivity of measures with respect to the severity of the pandemic. At the same time, there seems to be some sort of herd behavior among countries regarding their measures. Public trust can influence people's responsiveness to containment measures. There are three types of learning to live with the virus over time. First, by governments, second, by people, and third, also with respect to economic activity in response to mobility restrictions. The balance sheets of firms, households, and banks react to the pandemic crisis very differently from usual recessions. This will be important for the recovery. The relative weight of supply and demand shocks has evolved in the course of the crisis, and our understanding of them has changed. Global trade has bounced back faster than expected. Non-health system and containment measures and public health policies have proven to have a strong impact on R. Public gatherings, lockdowns, and school closures, but also testing, tracing, and isolation measures have proven to be the most effective measures in most countries. Creating awareness and responsible behavior can help reduce the economic costs of containment. The emergence of new virus variants will reduce the effectiveness of containment measures. There are inevitable trade-offs between various types of costs, economic and non-economic. Politicians, by necessity, need to take a comprehensive view, including short-term versus long-term considerations. This also applies to the next few months when governments will have to shape their opening up strategies. There are countries that have done worse. France, Belgium, Italy, UK were mentioned, or better, Australia, New Zealand, South Korea were mentioned, than average in their overall cost score. This may suggest that a zero COVID strategy might, with hindsight, actually have been preferable. Looking forward with respect to vaccination campaigns, there is not only an ethical but also a strong economic case for covering all of the world with vaccination. Otherwise, costs for the world, including also those for emerging economies, will be huge. And the resulting disruptions in global value chains might also drive input prices and inflation. Let me cordially thank all the speakers for their presentations, for the interesting insights that they shared with us, but also to all participants for your interest. Note that 2 SUERF policy briefs by David Miles and colleagues and by Cécile Philippe on this theme have just been released on SUERF's website. With this, all that remains to be said for me is thank you again to all the speakers. Thanks to all of you for participating. Bye-bye and take care.